Health passports. Few topics in the COVID-19 era stoke more debate. Many leaders see them as a key to normality.
I think that is going to be a factor of life, probably.
But others just see a door to discrimination.
I say scrap it and let's just get on with life again. Stop trying to control the people.
The best case study to see the tensions at play is the European Union, which has proposed the Digital Green Certificate to help revive a tourism industry on its knees, after southern states warned their economies can't withstand another summer of deserted beaches. But developers are facing a host of issues, ranging from the practical to the philosophical and moral. Let's look at how the scheme would work in practice and some of the thorny questions that arise. The EU-wide pass is slated to launch in June and will allow travellers to cross borders freely again if they have been vaccinated, tested negative, or recovered from COVID-19. The pass would be issued by a doctor or health centre and feature a QR code that can be scanned into a smartphone app, giving people a portable proof of immunity in their pocket. There isn't going to be one pan-European app. The 27 member states are each creating their own. Estonia is considered to be the furthest along, but others aren't far behind. France is already testing its app for airline flights. Alongside Germany, it's planning to add to or build upon its pre-existing contact tracing app. The European Commission plans to issue a contract for a central gateway, making it possible for all the separate national apps to talk to each other. That would assure that, say, the German app could easily be read in Portugal. If you think it all sounds pretty complicated, that's because it is, and there are many issues being wrestled with. For one, there is a big question mark over whether vaccines or past infection really do lead to immunity. The WHO has spoken out numerous times against the scheme for this very reason.
At this stage, we would not like to see vaccination the vaccination passport as a requirement for entry or exit, because we're not certain that at this stage that the vaccine prevents transmission, and there are all those other questions, apart from the question of discrimination against people who are not able to have the vaccine for one reason or another.
That second point mentioned, discrimination, is another big concern being voiced on streets across Europe.
Hay muchísima gente que no nos queremos vacunar, entonces, ¿por qué no nos fiamos de las vacunas? Yo si fuera una vacuna como la del tétanos o la de la varicela o la del sarampión, sí, pero una vacuna que lleva tan poco tiempo, yo no me fío. Entonces yo no tengo por qué quedarme en mi casa encerrada, discriminada con otras personas que se hayan vacunado.
The issue of vaccine passports, however, hasn't become the political hot potato seen in the United States, where concerns rage about their impingement on civil liberties.
Americans' privacy and rights should be protected, and so that these systems are not used against people unfairly.
The EU has already promised to open its doors to vaccinated Americans this summer.
We are working hard to propose a very concrete solution, especially for your citizens who are vaccinated, so with a special pass, I would say.
However, no global standard has yet been agreed, meaning work still needs to be done to deal with overseas visitors in Europe. Member states also worry about the security of personal information and if the scheme would be vulnerable to fraud. Concerns about digital tracking too loom large. The European Commission has promised the health passes will contain minimal data. Anything sensitive will typically be stored locally on smartphones, while the EU Gateway will only handle the signatures on digital certificates.